Okay. Good morning, everyone. Welcome to our 71st session for CMAAO, International Weekly Meetings, every day Saturday at 9:30 a.m. We are on 14th of August, and today also it happens to be Pakistan's International Independence Day. So congratulations.
Thank you, sir.
Thank you. And today we have a very important topic again on masking. We have seen this is one of the very major criteria for avoiding infection. So we have double masking as a medical mask. Also, we would cover another topic, which is challenges in the life of a doctor, especially a surgeon, during the COVID era. To present this topic, we have Professor Dr. Ashok Gupta. He's a very renowned reconstructive plastic surgeon of the country. He has been awarded as Padma Shri Award by the President of India. It is the same award which Dr. KK also has it. And it is one of the highest civilian award after Bharat Ratna, Padma Vibhushan and Padma Bhushan. He has also been awarded as Lifetime Achievement Health Award by USA at Global Official Dignitary Awards. He's been awarded by Sheikh Award by a Deputy Ruler in UAE and a Queen Victoria Award in UK. Over to you, Dr. Ashok, for presenting.
Thank you very much.
Good morning.
Good morning to everyone.
Morning.
And can I share my screen? Good morning to everyone.
Yes, Dr. Ashok, you can share your screen.
Yes. I will start with the double masking first.
Okay.
Can you see everyone?
Yes, we can see your screen.
Yes.
So I will share this double masking is a current issue. How double masking can save the spread of disease even for the general public also. Thanks to Saurabh and Dr. KK Agrawal Foundation. KK have been associated. I've been associated with KK almost for the last 20 years, and we know each other almost since the days of when he was a medical student at Sevagram Medical College. Since those days, we have been interacting with each other. So it's a real honor for me to present the use of double masking to prevent the spread of the disease. Not changing. Sorry.
Dr. Ashok, you need to enhance. Can you press the?
Yeah, I'm doing that.
Yeah, and then you can do it.
Yes, I'm doing that.
Yes, now you can.
Yeah. In the current COVID pandemic, everybody knows that the pandemic isn't over yet. And with the new virulent strains emerging every day, particularly Delta variant, it is very important to safeguard ourselves from the spread of the virus. Even with a vaccine, one of the steps we must continue to take is to keep wearing a mask during the upcoming third wave of COVID-19. And there is no excuse for doing that. The best protective vaccine is MDH, and which I agree with most of the people, those are recommending, is a mask, social distancing, and hand hygiene. These are the three most potent vaccine which is available with us. Now, population across the world have failed in following and sustain good COVID behavior due to ignorance, indiscipline, or sometimes stubbornness. And this is not limited only to Asian countries. This is I have seen in during my recent visit to US and UK that people are stubborn and they say we are strong enough and we don't need mask and we don't need to follow these things. So it is because of this, I would focus only on the use of mask during the COVID. And as all of us know that there are different type of face masks are available, which include the surgical mask and cloth mask. They have been employed by people in different combinations and as a personal health control measure against the spread of COVID-19. This is a picture taken in one of the thing where they had an ultraviolet scanning of the spread of the virus type which comes out from the mouth. As COVID-19 spread primarily through respiratory droplets from a COVID-infected person. Even laughing, talking, coughing, or sneezing can lead to spilling of millions of droplets and viruses like this. Now, masks markedly reduce axial respiratory droplets and aerosol from an infected wearer and reduces exposure of uninfected person with the wearing mask. Now, mutation of Delta COVID-19 pose challenges as the latest wave of coronavirus infection in India and other countries. The three recently detected SARS-19 variant, which is British, South African, and Brazilian, are usually divergent, and each possesses a unique mutation potential. And we had to be very, very careful, as been reported by the US, the Surgeon General of the US, that 93% of the Delta variant is, new cases are responsible are because of the Delta variant in US also. The universal face masking is the most effective strategies recommended to slow the spread of disease. Until vaccine-induced immunity is achieved, universal masking is the highest effective means to slow the spread of the SARS, the COVID-19. And by wearing a double mask, we can stop the spread of the COVID-19. Masks are not perfect barriers to spread and should be combined with other methods, including social distancing, which I mentioned before. Many people with COVID-19 are unaware that they are carriers of the virus, and use of double mask can greatly reduce the virus spread in the community. Now, double masking, in view of the impending third wave, we must be strict with appropriate COVID behavior, including social distancing, minimizing trips to the public places, and wearing double masks. Cloth mask face covers offer little to no protection, subject to the material, number of layers, and the fit. A simple double mask is the savior of community in our group. Now, CDC recommends wearing of two masks. There is a recent recommendation by CDC, a new guidance for slowing the spread of diseases to double mask. Wearing a cloth mask on top of a surgical mask improves the fit of the surgical mask. This is proved beyond doubt. The closer fitting the mask is, the fewer gaps there are between the mask and the face, and where the chances of infection and spread of the infection is minimum. Double masking typically means layers of two masks, one over the other. Double masking is initially used widespreadly by the frontline healthcare workers and warriors, but double masking creates a tougher barrier to stop germs and viruses from creeping into the face within the crevices. Even with two masks, you will still be able to inhale the oxygen you need and exhale the carbon dioxide. So this is one of the pictures presentation of how double mask can be used. A surgical mask before and a cloth mask or a top of it, or it could be double surgical mask. Two masks might may not feel comfortable to begin with, but still it is useful and people get used to it. As a surgeon, we have been using double masking almost for last 40 years. I'm using double masking in my all complicated surgery. So it is not very unusual to use, uncomfortable to use double mask. Double masking of a medical product, medical procedure mask is usual practice in some of the high-end sophisticated surgical, which I mentioned. And this is normally we use a eye shield on top of our glasses and double masking. In the current era of COVID, we are forced to use the face shield. We are forced to, when we do a major microsurgery, we are wearing our gloves. We are wearing a face shield on that on top of a double mask. So it becomes a little bit of a cumbersome procedure for a surgeon to undertake major microsurgical procedure or a complicated surgery. But medical procedure masks are usually 3-ply. If your two masks fit well, this combination should produce an overall efficacy of almost 90% for the prevention from the particle of 1 micron entry. Now, in the first layer of mask, it is very important. In the first layer, when you're wearing a double mask, in the first layer of the mask, which is inner mask, The dark blue or a green side of the mask, which is a fluid repellent layer, is to be worn outward, with the white layer, which is absorbent layer, should be inside. I will share what is the importance of these two. In the second layer of mask, which is outer mask, the dark blue or a green should be the layer mask should be worn inside, with the white layer, which is absorbent, should be outside. Very, very vital to understand that. Now, there are three levels of mask. Before going to that, I will say there are three levels of surgical mask for a face or a general paper mask. Level one is a face mask for both surgical and procedure application with a fluid resistance of 80 millimeters of mercury. They are not meant. They are meant for low situation spray, etc., and basically used for paramedics and healthcare workers. A level 2 mask, which is about with a 120 milligram of resistance, which is of 160 millimeters of mercury. So these level 3 masks are basically used for surgical team, and level 1 and 2 can be used for paramedics and the circulating staff of the OT. These are commonly known as surgical masks, which are of three layers of three plastic. The outer layer, which is the permeable layer, which allows the air to come inside, is either dark color or blue color or green color. The inner layer of the mask, which is always of white color, to proof and does not allow liquid and fluid to go out. Many times when surgeon is operating, there are some secretions including saliva, etc. That's the reason white layer is a fluid resistant layer. So the correct method of wearing the mask is must be stably fitted on your nose with a clip. Rare situation when we are faced with high standard of surgery or in COVID conditions when there is a lot of contamination, it is recommended to wear double mask or two-layer mask. It means the double layer, second layer mask should be white layer outside, so it will protect the wearer from any scoop of fluid coming out from the person who is from outside and either sneezing or something in front of you. So with white layer outside and a blue layer inside will give additional double protection. And with the current study, it has shown that up to 90% of the protection has been achieved by wearing a double mask. So if you wear a double mask, ensure that white layer is outside in the outer mask and the white layer is inside in the inner mask. Then you can combine surgical mask with a cloth mask, and on top of it surgical mask with a white layer inside and blue layer outside. He can wear additional cloth mask in this fashion. The recent study done in USA and UK has shown that
Can you speak clearly, please?
surgical procedure. This is a recorded. This is a record. Protection from the viruses. It is very important to wear mask. Very important to wear mask properly, and it is important to wear mask to protect life. Sorry, this was a recorded video, but I can share that this is very, very important to understand that the white layer, which is the absorbent of liquid and saliva, has to be worn inside when you wear the first layer, and the second layer it should be outside, so that whatever liquid or the thing is coming from outside is absorbed by the mask itself. Now, this is a comparative study which has been done to show various mask protection efficiency. N95 offers almost like a 95% protection against virus, 100% against bacterial pollen cells. The surgical mask offer 95% double mask, 95% mask, and bacterial is about 80%. And similarly, the cloth mask, ordinary sponge mask offer the activated carbon mask offer only 10% of the protection. Now, there are some additions have been done where the chemicals are being coated on the paper mask, which will deactivate the viruses and which will deactivate the bacteria, but still has not been proved by the scientific study, nor has been approved by the FDA. So I would not recommend any of those masks. Again, we say the cloth mask, a single layer cloth mask or a double layer cloth mask without the third layer offer almost 0% benefit protection from the virus. So this is very, very important for us to understand what is the role of a mask. Now, N95 masks have been widely recommended for people who face high exposure risk, and which is commonly used by the public at large and by people in the hospital. But basically, it should not be used for general public unless they are exposed to high risk. N95 masks cannot be reused and before proper disinfection, and they may not be very cost effective. It is recommended that at a stretch, we should not use it for more than 8 hours, and after 8 hours, this has to be kept aside at least for 7 to 2 hours for disinfection, and then only it should be reused, recycled. So this is very, very important. People at a stretch sometimes wear for 2 or 3 days the same mask, and which is not really safe for them. The disinfection and reuse of these masks also require proper protocol and to deem them effective. And it should be stressed that any mask will only be effective as long as it is worn right. And correct use of mask, etc., whether it is a N95 mask or two masks over each other, ensuring the proper use. The best proper use of mask with a proper fitting mask and with a properly used mask is the key of protection of the uh, current crisis. And I think this is what I had to share, and I'm open to question answer. Or shall I go to the second part also?
I think before you can go to the second round, second presentation, I was just trying to, because I think the audio was not clear. So this is the mask what you were showing. So
yes,
so this is the blue area and this is the white area.
Yes.
Okay, so you're saying the first inside nose, this will be the area, and
Yes.
if you took the second mask, the blue, so both the blues are inside.
Yes.
When you wear, right?
Actually, these three layers are specially colored and they have a specific purpose. The white layer is the absorbent layer, which absorb all the secretions, etc., which have come from the mouth of a person. Similarly, when it is worn outside, it will absorb the liquid and secretions which are being thrown on your face by the person opposite you. And so that is what it has to be used that way. And the blue layer or a green layer has to be in between. And there is an absorbent layer. See, all surgical procedure masks are 3-ply masks. So between the white and blue, there is an absorbent layer which actually neutralizes all the bacteria. And we are not sure about the viruses, but definitely they neutralize bacteria.
Okay. And
Dr. Ashok Gopal, would you like to accept questions?
Yes, please go ahead. Yes.
Yeah, thank you so much. This is actually regarding the cloth mask. Actually, in general, the people are using the cloth masks more, and especially in our subcontinent, those who are hardworking people, actually, they use this cloth mask because they are not habituated with the surgical mask and they cannot tolerate it also.
Yes.
So previously, we are knowing it actually that it gives protection to protection from virus 70% to 30%. It depends on the actually layers. Actually, 3-layered actually is suggested. But today you are telling that 3-layered also gives 0% protection. That actually, please justify this.
No, it is the normal cloth masks which are being used by public are either single layer or double layer. They are not 3-ply masks. The 3-ply mask must have a absorbent layer in the center part. So that is very actually with Dr. Mishra, who is also a member of our roundtable group, and we are insisting that the government must set up a guideline for proper manufacturing of masks, because masks which are available on the street and with the vendor may not fulfill the criteria of a proper masking. It must be a 3-ply mask with an absorbent layer in the middle. Whether it is a cloth mask, paper mask, whether it is a non-woven fiber or a N95. N95 become a fashion, but N95 masks are not really required by everybody unless they are exposed to high viral load. And a cloth mask must be, and again, cloth mask should be washed properly after 8 hours of use. It is not something which can be used at a stretch for 2 days or 3 days. It has to be kept for proper protocol, and that has to be conveyed to everyone using the cloth mask also. Whether it is cloth mask or cloth cover, people don't wash them, don't properly use them. It's very, very important to have at least 3-ply cover.
So just to reiterate, these are the 3 layers. I just turned one mask. So this is
Yes.
first layer.
Yes.
This is the second layer,
Yes, yes.
and this is the third layer.
Third layer, yes.
You can see clearly the three layers.
These are very,
So
very
lot-
vital.
Yeah.
Very vital point.
So a lot
And-
of people may not have, like a lot of masks may not have these three layers. So
Yes.
this is what you have to check. So when you buy, you can probably take out one mask, tear it off, and see if these layers are, and these are very good quality, And then the nose plate is very important, right?
Yes, yes.
So this is a nose plate. If you do this, so it keeps on, like it will take a shape.
Yeah, these are what we are saying with Dr. Mishra also, that the government must come out with a specification of mask and mask manufacturing so that we are using a proper mask. And this is very, very vital for the prevention of spread of the disease. Use of proper mask that's what has been proved. Double masking has really prevented almost up to 90% of the spread of the virus.
Sir, can we use another mask on this mask?
Yes.
Can we use, this is the 6th layer. Can we use a double mask or one mask on this side, on this type of mask?
Actually, N95 masks are supposed to be 5-layer. All N95 masks, they are
Six.
disposable. 6-layer or 5-layer minimum. And if you are using an N95 mask in a situation where there's a low load of virus, you don't need a double mask
Thank you, sir.
from the layer point of view. But if the fitting is not proper, the virus can enter your area from the side. And that's the reason, on top of it, if you're wearing a cloth mask, which ensures a proper fitting, it is beneficial. Double mask
Thank you.
has got two advantages:
Thank
adding
you, sir.
layer and making it proper fit.
Yes,
Thank you.
proper fit and
Yeah, proper fit is most important.
Dr. Gupta, actually, previously it was I think, given the guidance from the WHO that N95 mask, actually, if it's kept for 7 days, and then it gets virus free. After 7 days, you can reuse that. Do you support that? No.
Actually, the life of virus is supposed to be 72 hours. I'm saying that this is a presumption. So any N95 mask which is to be reused has to be disinfected, kept on a separate shelf for 72 hours before it recycled. So whenever people were trying to recycle the mask, we recommend you must have at least 5
Yes.
sets of masks, one to be used for 8 hours, and if you require for another 8 hours, use the another set. Properly clean the mask and use it for disinfection for 72 hours before recycling. So the cost wise, the N95 mask with a respirator, etc., become too expensive for a general public. And I still feel that the N95 mask should not be used for general public unless they are exposed to higher risk of viral load in a situation. And maintaining a safe distance and hand hygiene with a proper fitting mask is good enough for general public in case they are not exposed to higher load of viral infection.
So how you
Dr.
do the disinfection of the N95 mask?
There's a special process. It has to be cleaned with the chemical solvent which actually kills the viruses. There's a special protocol for disinfection of the chemical, and then it has to be alcohol based so that it evaporates. It doesn't stay on the mask. And I would not recommend reuse, because the person who is using a N95 mask in a situation where there's a high viral load, whatever amount of disinfection you are doing, it will not give a 100% cleaning. So in a high risk load, it is better to dispose of the mask properly. Again, the biggest super spreader of the disease has been the hospital biomedical waste. And I think very, very important to dispose of the PPE kit and mask in a proper way. And that's a very important topic. I think I will request Saurabh one day to touch upon that also. Proper disposal of biomedical waste.
Yes, we can do that.
Dr.
In fact,
Gupta, can I ask one issue? In the community who is not buying even one mask, if I'm going to promote 2 masks, and cost-wise, how they're going to do it? Because it's supposed to, government supposed to distribute to the poor community to wear the mask. So now how best we can promote to the ordinary community and the people who cannot afford? Thank you.
Yeah, it's $1 million question which we have been fighting for last 1 year. And this is the time when I request various NGOs and other organizations to come forward. And I don't say that giving free food to COVID victims and survivors is a bad thing, but giving masks should be given a priority over giving a free food. I think this is my personal feeling as a doctor, that giving mask, proper fitting mask is something which is very, very vital for society, not for their protection of the community, but their own self-protection. So if community takes this on a priority of providing a proper fitting mask with a proper specification, with Dr. Bijan Mishra is fighting with the government and saying that we must come out with a specification, I think that will be the greatest service to the community by any not-for-profit organization. Thank you.
Can I ask a question?
Please, please.
May I ask a question?
Yes, Dr.
I was
Please.
wondering if we get cloth masks, get it tailor-made. Initially, I started that and started distributing it in different bazaars and to shopkeepers and vendors, because they can wash it and reuse it, because they don't know anything about sterilizations, aerosols, or alcohol. They can't clean it. So if we give it 3 layers, 2 cotton layer and an absorbent layer, which can be a piece of muslin in between, do you think that is all right?
No, as long as they are 3 layer, they are all
That
right.
was my question.
Yeah, they are all right. But again, reusing a mask has to be properly sterilized. And not sterilization of the mask important, but the killing of the viruses which get collected on the mask. If you are using a cloth mask and the virus load has already collected on the surface, it must be killed by a method which is appropriate for killing the virus. It is not washing which kills the virus. It is the method of killing the virus, disinfection, which is very, very vital.
But when Dr. Gupta, when we say that soap is the actually killer of the bacteria virus. If you keep it 20 seconds, so if you keep the mask in soap water for 20 seconds or half a minute, that's over. It should be over.
No. I think it's a misconception. Soap
Why?
is not a killer of virus. Soap only removes the grease collected on your hand and body. So the process of soapinification is to remove the oil-based collection on your body. Soap does not kill the virus in 20 seconds. You must wash for 20 seconds or 30 seconds to remove all the greasy layer collected on your hand or face. So that is the whole purpose of soap. But
do you think? Do you think that is it just removing the virus only from the air or just killing? Actually,
No,
we are knowing it from the
it is
beginning.
not.
We are
It is
knowing it
not.
that soap kills.
No, it is not the viruses which are removed. It is the grease-based deposits on the hand and body which are removed by the soap. That's the whole process of soapinification is come from the chemical technology, which is a process of soap is formed and that removes the oil-based collection on the body. But by washing it for 20 minutes in the soap does not kill all the viruses on the cloth. It has to be kept for a longer period. There's a special process of disinfection. It is not only the soap, it is different chemical also which are used for that. So I think very, very important for reuse of mask, it should be properly disinfected for the virus.
So, Dr. Gupta, can you cover some kind of are there any respiratory infections wearing a long mask, like without, if somebody is wearing a mask for long term without changing it, or not frequently changing it every day?
Actually, it's not only wearing, even touching the outer surface of mask. When you are wearing it and you are exposed to some other people where the virus are collected on the mask, and if you are touching mask and adjusting and touching other part of the body, you are spreading the virus to other part of the body. So you are getting infected yourself. Same thing, if by chance the viruses have entered your area and you are rebreathing from that area with a mask, you are inhaling the infected air yourself. So that's the reason why it is recommended that any type of disposable mask or a reusable mask should be worn at a stretch for not more than 8 hours without touching the mask from outside. And if you happen to touch the mask, this is more important from the surgical care point of view. When you are in the hospital, when you touch the mask from outside, you must immediately change the mask. You must disinfect your hand People are using the disposable glove. People are using disinfectant. So you should not touch the mask from outside, because that's the surface which invariably gets contaminated with the virus load. So it's very, very important. The proper use of mask and proper mask behavior is very, very vital for the prevention of spread of the disease. And we have seen so many hospital-based infection coming. We have seen so many junior doctors and even intern residents getting infected because they did not know how to use the mask properly.
So there is a message from Dr. Monica in the chat. We can all read that. It says how to clean the fabric mask.
Yes.
It says wash fabric mask in soap or detergent and preferred hot water, at least 60 degrees Celsius to 140 degree Fahrenheit, at least once a day. If it is not possible to wash the mask in the hot water, then wash it in the soap and detergent at room temperature, followed by the boiling of the mask for 1 minute.
I think boiling is the best thing to do, because boiling kills most of the bacteria and virus also. But apart from that, it is very, very vital to use the mask appropriately. And you should keep at least for 72 hours gap between recycling the mask. That's the vital part. Even if you want to reuse the same mask, give a gap of 72 hours before using the same mask. So you should have a collection of 4 to 5 masks if you want to use the reuse the mask.
So Dr. Gupta, just I think we can skip the second round of presentation for today. We can take that on another day.
Yeah,
welcome. Because I think we are getting a lot of questions on the masking, and we have to get a country updates also.
Yes, yes. Thank you.
So we can take the second part of the presentation, which is a surgeon slide.
Dr. Gupta, actually, what I said, actually, the soap actually just it disintegrates the covering of the viral covering. It was there. But
no.
Is it changed? Is it changed now?
No, it is not changed.
Initially, because 20 seconds are said. Actually, usually we do not wash our hands 20 seconds by soap. Usually before this virus came. Okay. Now the practice it was advised that you should wash 20 seconds with soap to just kill the virus from your hand. That was said initially. I don't know. I have not gone later. But this I used to know.
I really cannot comment on whether the 20-second wash will kill the virus or not. But I know right from as a surgeon, we are supposed to scrub for 3 minutes minimum, or 5 minutes. And despite 5 minutes wash, when we take the soap from our hand or anybody's hand, there will be still growth of bacteria and viruses from that. So surgical scrubbing, which is mandatory for 5 minutes, does not kill all viruses and bacteria. So I say what the soap does is to remove all the grease-based deposits on the body. And that's the whole purpose of soaponification and the process of soaponification. But I'm open for suggestion by any other expert which can confirm that yes, 20-second use of soap will kill the viruses from the body. I mean, I'm open for that correction. But as a surgeon, we are mandated for this scrubbing for 5 minutes, surgical scrubbing.
Can I ask a question here, please, Dr. Gupta?
Yes.
I just want to follow on what Dr. Jamal spoke about. We have been advised to wash our hands with soap and water for 20 seconds.
Yes.
Based on the, or maybe we have wrongly accepted this, that based on 20 seconds will kill or remove the virus from the hand. Otherwise, why do we need to do a 20-second wash just to remove the grease and all that? It's more the virus that we are worried about.
No, viruses are deposited on this substance, which is a greasy based or a secretions. And to remove that substance from the body requires minimum of 20 seconds or 30 seconds of scrubbing. So that's the perception. If you start explaining to each and every one that you don't kill the virus, but you remove only the grease, probably they may not follow this. Mm-hmm. So this is one of the method of convincing people that you must wash at least for 20 to 30 seconds. At least 2 or 3 washes or run of the water should be used for cleaning your hand, because one specific soap application does not remove all the grease-based thing. And that's my conception right from the surgeons when I started my residency in surgery in 75, that soap and water wash is the best wash for a surgical scrub rather than using any of those alcohol-based things, because alcohol-based thing does not remove the greasy substance as effectively as the soap and water.
Okay, so what is the role of the hand sanitization here now?
To me, as a surgeon, it is doubtful. Hand sanitation, alcohol-based thing cannot, it evaporates the liquid, but how much it is effective in killing the bacteria and viruses is something which I cannot say. All hand sanitizer has to be alcohol-based so that they don't stick there. It has to be non-sticky material. But what is the effectiveness of their killing virus and bacteria? Probably virologists and bacteriologists can say. But as a surgeon, for me, most effective method of removing the oil-based or the grease-based deposits in your body is the soap and water.
So why are they recommending sanitization, hand sanitizing using alcohol-based?
This is beyond my scope of my thinking.
Because in
Very big question.
in Malaysia, what's happening is they have hand sanitizers in any outlet you go to. So it's as if it's a miracle thing where you wash your hands with a hand sanitizer, voila, no more virus on your hands or something like that.
No,
I would like to add over here something. The reason I use hand sanitizer is because of the convenience. You can't get out of the car and use a hand wash. So it's just a convenience that it's there. Now, again, the use of hand sanitizer and how effective it is a question which I think.
No, it was also advised because of this virucidal effect.
No, I'm saying the hand sanitizer also have a specification of 90% of alcohol base, some components of stuff because of commercial use and so many other people.
70%, Dr. Gupta, it's
70,
advised 70%.
Minimum 70%. Minimum 70%. But again, as a surgeon, having experience for so many years, I say the miracle is only the safe distancing and double masking. And of course, hand hygiene, which is very, very important from the COVID point of view, which has proved effective in all situations. Even in the worst situation in hospital care, when we are involved, my hospital was declared as a COVID hospital, 85% beds were COVID. But despite that, with 1,200 bed effectively looking after COVID patient, we had to attend the hospital every day. Despite that, with proper precaution, touch wood, I am safe from the COVID. So this is the best way is to prevention. And there can't be better vaccine than the prevention and following the MHD.
So that means, I'm sorry, Dr. Gupta. So hand sanitization, like Dr. Monica just mentioned, that she does not use because it gives drier hands and leads to dermatitis and all those kind of things. But how come we are being advised, like here, Ministry of Health is saying hand sanitization, wash your hands and all that. So hand sanitization, if it's going to be like this, then is it just psychological? Many people believe that using an alcohol-based hand sanitization will remove the virus or kill the virus.
Actually, it needs to be well defined when you are using a hand sanitation. What is the duration of the hand sanitizers to be kept on your body? What concentration to be used? What are the component in that? Apart from alcohol, what are the other component of this? See, the surgical thing which are used for disinfection and killing the viruses are not being used in every hand sanitizer, and some people may be allergic to those things.
Yes.
So these are something which is a big question to be settled by the regulatory authorities. But as my scope was stressing the importance of a double masking in prevention of the disease, which is even endorsed by the Surgeon General of USA and CDC. The double masking, even the Dr. Fauci has also stressed the double masking is something which is definitely going to prevent. And as a doctor, I feel is a very, very vital for us to stress upon a double masking, a proper fitting mask. Double masking will ensure prevention of the spread of disease from you and from others to you. That's very, very vital. Other parameters, of course, social distancing, and we can have the proper analysis of what is the correct use of hand sanitizer, what is the proper concentration of hand sanitizer, and what should be the duration of hand sanitizer to be used. Just putting hand in front of the spray and washing out with this thing is no use.
No use.
No use. It is just a satisfaction that we are following something. And also a very important point which I have mentioned also, proper disposable of biomedical waste, including PPE kit, mask and glove. In our community, I have seen people throwing everywhere.
Everywhere.
In the street.
Yes.
And that is more dangerous, and we must be stressing upon the proper disposable of the glove and mask. It is easy to wear a mask, but also it is equal responsibility of people to dispose of the mask and glove properly.
Yeah, correct. That I agree with you.
They should not be just thrown in public. And if we don't follow third wave, fourth wave, fifth wave, maybe even much worse than what we have seen so far. This is my fear.
So before we move to like the country updates, do we have any other questions? And does Dr. Monica has to speak anything on it? Because I see a lot of information coming in from her end.
Yes.
And everybody's waiting for her to speak, I would say.
Thank you, Dr. Gupta, for a fantastic presentation. It's very nice to hear about the basics again in terms of common sense, in terms of distancing, masking, and hand hygiene in an era where a lot of conversation has been focused around vaccine and Delta variant. But coming back to these topics, which we started the pandemic with, is very important because I think we've lost these important but simple messages along the way. So I agree with you that double masking is very important. Mask fitting is very important. Even when you wear an N95, at least in a hospital-based setting, you get fitted for one. So just as important as it is to get fitted for an N95, we have to make sure that we are closing the space, whether it means putting an elastic band or a facing, something that allows the mask to fit to our face properly is important. We've all gained and lost weight during the pandemic. That affects our facial structure and how the mask works for us. We also have to understand, what are we talking about? Are we talking about guidelines within our clinical scenario, where community spread is high or community spread is low? What is the likelihood of the patient that is in front of us being infected? Versus the community, what are we doing when we go out, when we're going to the markets, or when we're spending time with friends and family? So in a hospital-based setting, hand washing is always the best thing to do. You can never go wrong with hand washing and soap. Hand sanitizer, I feel like, is an in-between thing. You're using hand sanitizer as an in-between step. Now, we have discussed that not all hand sanitizers are created equal. You have to trust the manufacturer of the hand sanitizer that you have, that you've got the percentage consistency. But if you're using soap and water, you pretty much have a much better guaranteed chance of being able to use the right method. You'll get the soap all the way up. You may not be using the hand sanitizer that efficiently because your process is to be quicker with the hand sanitizer. The thing about understanding about the hand dermatitis. So as an allergist, I do see patients with eczema, and I'm seeing that those patients who have baseline eczema, their eczema is getting aggravated because we're taking away that protective natural skin barrier and making them more prone to eczematous flares. But not only that, when they have a flare, they're also more prone to secondary infection, whether that be viral, bacterial, or fungal. Patients with eczema get molluscum contagiosum. They can get secondary cellulitis. And so we have to be very careful about that barrier that we are breaking by using all this hand sanitizer. And I still feel that using certain soaps that have been approved for these patients are much more important than the hand sanitizers. Dr. Gupta, you've done a fantastic job for bringing up this topic and for explaining and teasing out small areas that we had not realized needed to get needed special attention. So thank you.
Dr. Monica,
thank you very much.
Just one thing to Dr. Monica. Whilst I fully agree with you, Dr. Monica, regarding a hospital-based setting, of course, it's easy for us to wash our hands with soap and water because of the availability. Now, when you're talking about the community per se, how are they going to be washing their hands in a mall or in a shop or something like that, in the market and all those kind of things?
I agree with you. So that was this part I didn't disclose. So there we have to reduce the barriers for hand hygiene. So we make it accessible. So having a little hand sanitizer in your pocket or in your purse makes it accessible, and that allows you. But we need to remember that when there is an option to have both available, that maybe we should remember that we should be hand washing in between those 3 or 4 times that we're hand sanitizing, so that we can do that as well. But yes, if the hand sanitizer is better than nothing, and then when we have the option to wash by hands, if I understand correctly what Dr. Gupta is also reinforcing, at least that's what I do, is that we hand wash as well.
Thank you. Just want to add the type of soap. Only in surgical setting, the chlorhexidine component is very, very vital in terms of scrubbing or a washing, because that's the something which actually kills most of the bacteria. But in a common setting, any type of soap, I don't endorse any type of soap. Any type of soap is good enough. You don't have to go for expensive soap or a enriched soap. Any type of soap is good enough to remove the grease and the component from the hand. And as recommended, 20 to 30 second or a two wash or 3 wash, etc., is very, very vital. If you wash it only for once and scrub for 20 seconds, 3-4 times, it is good. And keep it under running water. That's the best thing. Running water is better than the stored water for prevention, getting the more effective thing. I mean, these are the few basic things which, as a surgeon, we must follow. Thank you.
Thank you. Thank you.
Thank you
Dr. Monica, Dr. Monica, can you just point out to that process actually how you can disinfect the vegetables actually in this year pandemic? Because it is a question for vegetables and other foods actually. How can you? Virus free. How can you make it virus free?
So I'm not sure what the transmission rate is for vegetables, but if you rinse your vegetables and you leave them out within a certain time frame, that virus will not be present. Or if you're peeling the vegetable and you're taking away that top surface of the vegetable, you're fine. But I am not familiar with spread of virus based on vegetables.
Vegetables.
So I can just add what Dr. Keki said.
Because it is very possible here. Actually, a lot of people, they are not using the mask. And if there is a patient or is a asymptomatic patient, and if he's coughing, sneezing in the market, then it may just drop on the vegetables. Yes. So mostly actually it's very confusing actually, this practice. Actually, no one can surely say how it should be disinfected in the house.
Actually, that is what is being followed in my home also, that wash the vegetable properly, keep it outside for at least 6 to 8 hours time before putting in the freeze. And as a normal practice, most of the vegetables are being cooked well before consuming. And once the vegetable has been cooked to the level of boiling.
If you do not cook,
yeah,
most of
then also, I mean, on a safer side, the human saliva is strong enough to digest most of the bacteria and viruses. So it will not spread to because of the viruses. And if you keep a 6 to 8 hours of gap between you buy the vegetable and keep it outside unused, probably the life cycle of virus will be over. That's one of the method of being used in most of the houses in which I know of. Thank you.
Okay, so if we don't have any other questions, we can probably move forward. Dr. Monica has already posted the answers of your questions.
Today actually, we have entered into a lot of confusions actually.
No, so I think any confusion will result in more information. So I think we can take further sessions on it.
This is what we are practicing actually. That is the thing. That has created a lot of confusion. How we will continue actually the next day.
That was the whole purpose of stressing upon a proper use of mask. People feel that they have put on a mask without covering their nose and mouth.
No, what about the hand washing actually? Hand washing, not mask.
I mean, that's what I'm saying today. My focus was a proper use of mask, effective use of mask, and a proper choice of mask. That was the whole purpose of presentation. If I had known that these are the points, I would have also gone little more on the proper use of sanitizers and proper component of the sanitizer. I mean, as a surgeon, as I repeatedly said, 5 minutes hand washing with the soap and water is the best method of disinfection of or reducing the contamination of the surgical contamination.
Yes.
Yeah, and this has been universally followed all over the world. 5 minutes of scrubbing. Every time we scrub, it has to be minimum 5 minutes. We take out a break, we take a break, come back, re-scrub again. It has to be 5 minutes.
Yes, keep for it all day.
Dr. Gupta, I agree with you in a surgical setting. Let's say in a general practitioner's clinic, a clinic where GPs, I mean, if every patient you're going to spend 5 minutes scrubbing your hands, I think you're going to spend more time on scrubbing your hands than seeing the patients.
No, that's for a surgical scrubbing, I'm saying. But 30 seconds of wash is good enough to remove the bacteria. 30 minutes of
Okay.
grease, not
So
the bacteria, the grease-based deposits on your hand.
So in a clinic setting where you are seeing like a general practitioner where you see patient, that means 20 seconds is good enough.
30 seconds to 1 minute is good enough.
Okay, thank you.
And maybe you can use chlorhexidine as a on top of it.
Okay.
A solution which is available, chlorhexidine solution, which is a heavy scrub and all surgical thing you can use. Yes.
Okay, so shall we move forward, or do we have any other questions on this thing?
Very interesting
this was a
topic
long
today.
debate.
Very interesting topic today, Saurabh.
Very important.
In fact, when this topic came up, and I thought this is something which has been covered a lot of times, but then I realized how important it is at this scenario when the COVID is getting over and coming back. So in this scenario,
Saurabh, actually, that is actually the double masking, how you put on. That is very important, actually. This is very good. Actually, that you are not knowing actually the outside mask actually should be just the opposite direction like that. That was, we are not knowing it actually. Similar way actually insider one and the outsider one saying.
Actually, as a doctor, we should condemn this designer mask matching with the sari and blouse and matching with the same cloth, because they are not really something which is appropriate for COVID behavior.
Yes, I agree with you, Dr. Gupta.
So thank you, everyone. I think we will now move to our country update with a note. Please use hand washing for minimum 20 seconds. Sanitization, if not available, hand washing. And double masking is all you need to prevent COVID. With this confusions on a lot of faces, I would say, I will move on to update. So we have Mr. Chong from Singapore Medical Association. He's also the chair for CMAAO. We have Dr. Ravi Naidu from Malaysian Medical Association and immediate past president of CMAAO.
Hi.
We have Dr. Ashraf from Pakistan Medical Association. Dr. Pillay from World Medical Council. Dr. Salma, president from Pakistan Medical Association. Dr. Angelica, president for South Africa Medical Association. Dr. Jamaluddin Chaudhary from Bangladesh Medical
I think Saurabh is, Saurabh, are you all right?
Dr. Akhtar Hussain from South Africa Medical Association. Dr. Sajjad from Pakistan. Can you hear me?
Yeah, no, sometimes interpret, sometimes.
Yeah, you're breaking up. Saurabh,
Okay, just one second. Just one. Yeah, hi. Now is it okay?
It's okay now.
Yeah, I just changed my Wi-Fi. It's, I think, regular. So, Dr. Mary from Japan Medical Association, Dr. Russell from UNESCO, Australia, Dr. Bukhari from Pakistan. We have Dr. Monica from US, Dr. Sanchita from IJCP. And then we have a lot of other guests over here joining in from different part of the world. I thank you, everyone, and welcome.
We have Dr. Benito from
Philippines. I think I did announce his name, but I think it was lost in the Wi-Fi connection. He has to be regular. He has to be regular with us now.
Okay.
Dr. Bennett, welcome. I thank you from Philippines Medical Association. So over to you, Dr. Chong.
Thank you, Saurabh. Let's start the ball rolling. And today, instead of starting from India or the subcontinent, we'll start from Dr. Benito. Dr. Benito, would you like to tell us what's happening in the Philippines?
As of now, we have every day. Yesterday we have number of positive cases almost 13,000. with the total number of deaths of 28,000 and about 1.7 million of positive since the start of COVID. And we have some cases of health workers being vaccinated, but they contracted a mild with mild symptoms of COVID. There is an increasing cases of COVID among children. And almost our hospitals in Metro Manila were full, and even the provinces.
Thank you, Dr. Benito. How about Dr. Russell? Can you tell us what's happening in Australia, Dr. Russell? Are you still around, Dr. Russell? Is Dr. Russell around? If not, I'll move on to Benito. To Marie. Marie, can you tell us what's happening in Japan?
Thank you very much. We experience the fifth wave right now. That's, I will say, is extreme. And we are testing 20,000 people tested positive. And
Wow.
there are many severe cases among the younger generation. From first and the fourth wave, mainly severe cases were over 60. But now 40s and 50s are the main of the severe cases. And in ICU, 10% of them is 20s. So we are in a very severe condition. And also the Lambda variant has been reported. One case who is from the team of Olympics from Chile. And I'm pretty much worried about the spread of Lambda variant too. Thank you.
Thank you, Marie. I'm sorry to hear about what's happening in Japan. Can I move on to Dr. Hussein and Angelique to update us about South Africa?
Morning. I will quickly, and I will leave the numbers to Dr. Hussein. We are still seeing about 13,000 cases per day in South Africa. I'm just worried as well when, with maybe Marie can assist us here. The clinical picture of the Lambda infections, patients infected with that, is that more or less the same than Delta? Because we know the Delta and the Beta variant has got different pictures. So if we can just know so that we don't miss Lambda before our scientists actually telling us that there are Lambda cases, and we might miss them on the clinical picture. So that's one thing. And then in South Africa, something that is of extreme concern is the anti-vacciners. And unfortunately, it seems to us that a lot of doctors are part of that group. And it becomes a problem now as our vaccine numbers are not reaching where we want to be. This last week it keeps it's about 160,000 people per day that's been vaccinated, and it's way under the 300,000 that we need before December. So we have a problem currently in South Africa with misinformation. Don't know how severe it is in other countries. So, but the Lambda, it's a concern to me because I don't know the clinical symptoms. If anyone can just alert us on the clinical symptoms. Thanks. And the Atkar can give us the rest.
Hussein?
Thank you, Angelique. Thank you, Chair Dr. Chong. In South Africa, yesterday, I think we beat Philippines. We had 13,941 cases. In South Africa, total more than 15 million tested and 2.5 million came positive. Recoveries is 2.3 million. At the moment, active cases are 150,000. Total death so far 76,631, but the daily death is between 380 to 400. So the recovery rate is 91.2%. And the daily testing at the moment is around 50 to 60,000. From 1st August to 7th of August, positivity rate is 24%. The hospital admission, 14,587 cases admitted around the country, 2,266 admitted in ICU, total ventilation done up to 1,205 cases, and few COVID-19 positivity reporting from the health worker, those who are vaccinated. And I got one question supposed to ask initially, that what is the uptake of vaccination, the age between 19 to 35? If anyone can help on that. Thank you.
Okay, thank you, Dr. Hussein. We'll try to find some answers to your questions. Can I move on to Dr. Ravi, whether you'd like to update us on what's happening?
Thank you, Dr. Chong. Actually, in the number of cases, there's been not much change compared to last week. We are still seeing around 20,000 cases per day. In terms of vaccination, about 26 million people have been vaccinated and about 9 million have got 2 doses. So we still have about 16, 17 million with only 1 dose. But the biggest concern now we are facing is patients are being brought in dead due to COVID virus. That means what's happening is they contract the COVID and then they die at home and then they're brought to hospital. And this is an increasing trend that we are facing now. Yesterday alone, we saw about 96 brought in dead cases, which is a new record in Malaysia. The number of deaths, of course, are ranging between 200 to 300 a day. So all precautions are being taken, but I think today was a very good discussion we had regarding double masking and hand sanitizers. But I think we have a long way to go before we can actually control this COVID in Malaysia. Thank you.
Thank you, Ravi. And Deborah, would you like to update us with what's happening in Brazil?
Hello. It's a great pleasure for me to be here in your meeting. I have difficulties because of the time. I apologize. Here in Brazil, the cases are decreasing, the deaths too. We have almost 50% of the population that had 1 dose of vaccines. It's getting better, but now we are getting worried because the Delta variant, it's arrived here. Rio de Janeiro is the focus of the cases of variant Delta. So we are worried about this. Here in my state, about 40 doctors died because of COVID-19. But here we are getting better. I think in a few months, if God blesses, we will be safe.
Sorry to hear that, Deborah.
Thank you very much.
Yeah. Dr. Salma, would you like to tell us what's happening in Pakistan? Dr. Salma? Or Dr. Sajjad? Or Dr. Bukhari?
Yes. Thank you very much, Professor Chong. The
Okay.
situation. Okay, next Salma is there.
Dr. Salma, go ahead.
I'm so sorry. It's a bit worrisome because the graph is going up. It's varying from 4,500 to 5,000 new cases every day, whereas previously we never crossed the 2,500 new cases line. So that means the Delta variant is spreading, and somehow our population is taking it very, very easy. Yesterday, I went to the bazaar and there was not a single person wearing a mask. But again, I say that all these protocols for mask wearing, first of all, most of them are uneducated, so they don't follow it, and then there is a lot of poverty. So I am requesting you all to please devise something in which they can wear masks that can be washed. If we give them 2 or 3 and they wash it daily and rewear it, they can do that. But disposing it properly and getting surgical masks for them and for us distributing it on such a mass scale is next to impossible. So it has, the graph today is 4,786 cases and 73 people have died in the last 24 hours, which is very, very bad. But the good part is that 1/5 of our population has so far been vaccinated, alhamdulillah. So that is a good thing. I have another question to this forum. What happens to the virus when it rains? Does it settle on the earth and it gets washed away? Does the climate have any effect on the longevity or the survival of this virus? Please, somebody should address this issue. Thank you. Over to Dr.
Thank you, Dr. Asama. Dr. Sajjad or Dr. Bukhari, you'd like to add anything else?
No, I think
Thank you.
thank you very much.
Thank you very much.
Thank you.
Regarding some vaccination in Pakistan, somebody was asking about the vaccination under 18. No, our government has not started under 18. But now another thing, the government has suggested to give the booster dose. There is a criteria of the booster dose that the person has comorbidity, if the frontline workers are 60 plus, and if the chances of, or if the percentage of frontline workers are becoming more effective and take the Delta virus. So that was the one important thing that in Pakistan we have started this one. I myself and 2 other staff members of my medical college have taken the booster dose of the Moderna. Before we have taken the Sinovac, and after 4 to 6 months, we have now injected the booster dose, that is the Moderna. Thank you very much.
Okay, Dr. Char.
Yes, Dr. Sajjad.
Yeah, actually, this is a very serious issues here. I must discuss in this forum because in Pakistan, the government is not allowing people to have a booster dose or any mix and match vaccination. As WHO said clearly that there is no mismatch vaccination and booster dose till now. In future, it can be, but not nowadays. But the problem is that people are having this booster dose themselves. And the government says that we don't have any data. So this is the problem. The people are going abroad, the country where they demand Pfizer, Moderna, and something else, but that person have the Chinese vaccine. So on that issue, there is a very big problem. The people are very much disturbed that I have to have the Moderna or Pfizer and Johnson & Johnson and AstraZeneca. I have to take because my son is going for a study somewhere. This relative is going to for work there. So what I have to do? How can I prove in the airport that I have another vaccine? So the government is not issuing any certificate, anything in record that that guy is having another third dose of the vaccine which is required for that respective country. So this is the issue, and I think I have already told our guest, all the participants that being a Secretary General, I have written 2 months back to Director General WHO that those vaccines which are being accepted or recognized by the WHO, that those vaccines should be accepted to all over the world. Otherwise, WHO should not recognize that vaccine. If they have recognized the vaccines, they have to recognize, accept to all over the world, so that the people should not be disturbed for their any job or education anywhere in the country. So I think from this platform, from CMAAO platform, we have to write down a letter to WHO or the country, the other countries, or a press release, whatever. My suggestion is to just consider that, decide one thing. Either you decide that don't allow anybody in your country, or allow with the vaccine which is recognized by the WHO. I think so that the CMAAO, on the CMAAO platform, there should be a movement. Thank you very much, sir.
Thank you, Dr. Sajjad. We'll certainly look into what you've just said. Can I have an update from Dr. Chaudhry in Bangladesh?
Thank you so much, Mr. Tom. Actually, first of all, I support the motion actually taken by Dr. Kaiser Sajjad. Yes, it is very much necessary. Actually, if WHO agrees, then why not the whole world should agree? Because WHO only has certified, I think, 2 from China, 2 from US, and 1 from UK. 5 only so far. Oh, another Johnson is there. Johnson & Johnson, 6. So they should actually, USA also should recognize this vaccine. Next year, about Bangladesh, actually, thanks to our lockdown, actually, it has reduced the incidence. Actually, now the number of new cases has been reduced to 8,000 per day. It was previously, it ran up to 16,000 a day. So, and the number of deaths was hovering around 200 per day in the last 3 weeks. So it's still going on. And regarding the vaccination, actually more than 8.5% people are vaccinated so far. It's not that the double dose. I'm telling about the single first dose. So double dose, second dose also are going on. And actually, this vaccination, yes, the mission of vaccination is better. We are getting more vaccines mostly from China, actually. So thank you so much.
Thank you, Dr. Chaudhry. Can I hear from Dr. Pillai on what's happening in India? Dr. Pillai? Is there anyone, Sarab, is there anybody else that can help us with what's happening in India?
We can come back. We can come back on this. Otherwise, Dr. Ashok, would you like to cover something on Indian side of it? I know the cases are about 40,500. Kerala being the most of the part of it. Maharashtra, the cases are rising, but in the capital, it is like only 50 cases. Dr. Ashok, would you like to take it forward?
Yeah, actually, as per the recent report, Maharashtra cases are coming down. Maharashtra is opening up also, but the Kerala cases are on rise. Almost 20,000 cases have been reported. And recently, there's a report of a death of from a Delta variant in Maharashtra on a lady who was 63 years old and who was fully vaccinated. So despite that, this is the first reported case of a death from a Delta variant, which is confirmed by the state of Maharashtra. And this is something which is worrying to us, that if this is going to be the trend, what precautions should be taken to prevent the spread of the Delta variant. Thank you.
Thank you. I would just like to tell you what Dr. Russell left behind on a message for me. He says about Australia, New South Wales continues to be going up, 466 cases in the last 24 hours, lockdown in Canberra, Victoria, New South Wales and Queensland. And the vaccination, they hope to hit 80% by November with 2 doses. So that's the update from Australia. I just spoke to one of my patients from the World Bank just now about Indonesia, and the situation there is quite bleak. Apparently, the first 50,000 cases took 13 months to reach, and the next 50,000 took 9 weeks to reach 50,000 cases. So it's really accelerating over there. Positivity rates are like 20-something%, whenever they swap any population. And of course, all the ICUs and are chock-a-block, and the deaths are also piling up. So it's quite bleak over there in Indonesia, and they haven't quite figured out, what's happening. Java is, all the other bigger islands are also affected. As for Singapore, I'd just like to update Dr. Hussein. I saw the figure for our 12 to 39 years old. Vaccination is 88%. So that's a figure for you. Overall, we have hit 82% for first dose, and 74% has completed 2 doses. So we're on track, and we're moving more and more towards public health measures and vaccines, as opposed to border restrictions and social restrictions. So we are pivoting away. So that's what's happening in Singapore. I also like to announce that got Dr. Lee Voon with us. Dr. Lee was one of our past presidents of SMA as well, Singapore Medical Association. I think some of you might know who he is. So he's also joined us today. Anything else from anyone to update us?
I think
Dr. Pillai, are you still there?
Is trying to speak. Yeah, he's trying to speak. Dr. Pillai, can you unmute yourself now?
Yeah, I can. So regarding Kerala, India situation, we are still stuck with 40,000, 38,000 range, and particularly contributed by 3 regions or states: Kerala, Maharashtra, and northeastern states. And Kerala situation is worse because 20% of the cases are from Kerala. Vaccination drive is definitely going on. Almost 14% 1 dose and 40% double dose. And as per the experts, even this year, we may not be able to vaccinate all the eligible persons, but it is picking up and is becoming much faster. Regarding seropositivity, a state level, Karnataka state has conducted a seropositivity study, and it shows that antibody levels are coming down from 74 to now almost 25 or 30. So as time goes by, the antibody levels are coming down, and the experts are of the view that a booster dose has to be given by 6 months or 1 year. And that is gaining ground that booster dose may be necessary depending upon the population by 6 months or by 1 year. But an official stand on this has not been taken so far. The TPR continues to be around 16 to 20, and lockdown is regional, micro confinement areas. We are going for that, and generally the population and this is opening up with strict restrictions and the COVID appropriate behavior. Schools also, we are thinking of opening them, particularly the higher education, those children above 14 years and who had vaccine, 2 doses of vaccine. Then there is a thought that schools can be gradually opened up, maintaining strict regulations. So that is generally what is happening. Even mixing of vaccines. A study has been done in Uttar Pradesh, but the sample has been almost 16 persons. And the limited study shows that mixing of vaccine definitely increased the antibody level. But then the pre-study antibody level is not known in that population. The sample size is small. But then whatever has come out of mixing definitely favors mixing of vaccine, particularly in India, the AstraZeneca and Covaxin. China also is conducting a study using Sinovac and DNA vaccine, and maybe shortly we'll know whether mixing of, particularly in the light of the variants, the mixing of vaccines will be more useful than giving the same vaccine double dose. So this is in brief what is happening. Thank you.
Dr. Chong, just can I raise one point? Today, previously, I just raised one point to you so that we can have our virtual conference. Actually, you can just I requested you to contact our secretariat, CMAAO Secretariat, the Upon Medical Association, because in October, actually, WME is going to hold, it's going to it's conference, virtual conference probably this time also. So the last year we missed it actually. So this year actually we can go for it. Thank you.
Thank you, Dr. Chaudhary. I will look into that. Thank you. I'm sorry, I made a small mistake just now on talking about Indonesia. They were talking about actually the first 50,000 deaths took about 13 months to reach, and the next 50,000 took 9 weeks. So it's really accelerated over there in Indonesia. So that's my correction. Thank you very much, everyone, for coming to this meeting. And I think it's time for us to leave because the next meeting is going to start soon. Thank you all again, and always appreciate everyone.
Dr. Chong, I just want to ask one question. How many people would be comfortable shifting this meeting 30 minutes earlier? It's not confirmed, but just need a confirmation that will there be a problem with anyone having a meeting 30 minutes early? The meeting might end at the same time. We keep it this way.
Yes, we in Pakistan will have a problem because that would mean 8:30, and that's the time when we are going to our colleges, hospitals, and going to work. Traveling at that time.
Anyone else has a problem?
I think if it is half an hour earlier, it will be better, at least for Dr. Deborah and Dr. Malik.
Yeah, because I see a lot of people coming in from US and Brazil and all those who are midnight, 2 o'clock here, which is not that 30 minutes.
Difficult for Pakistan. We have for 6. It's too early for us here.
Oh.
Okay, so let's talk it offline and let's see how it works. Okay. So thank you, everyone, and
be safe and well.
Thank you.
Thank you very much.
Thank you.